Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert, and I am happy to be here today with my very soon-to-be vacationing co-host, Dr. Millicent Ravello.
Yes, that's true. I'm actually not really here in mind. I'm already gone. I already have a cocktail in my hand and sitting on a beach.
And by the time this airs, you'll be back.
I'll be back.
So
I'll be
that's
like
good too.
a blip in time. But no, in all
all
seriousness, I am very much here, and I am happy to be here because we are here to talk about you and some very wonderful accolades that you recently received.
I am, once again, like this ambushed me, which I always like, is when you get good news that you didn't know was coming. Because
it's better than a bad news
it's the
ambush.
other way around. Yeah, typically I get the bad news ambush. But this was a good news ambush because I was scrolling through my Instagram, and there I see Steve Cohen with, who's my buddy from San Diego, who I just think the world of. And it says, Newsweek's top, whatever, plastic surgeon for facelift and rhinoplasty, or whatever the lists that he got on. I was like, oh, they did that again. I wonder if I'm on the list. And I was happy to find out that I was on the list because that would have been a total bummer.
I've been kind of sad. I've been like, "Aw."
Yeah, but I didn't get any notification as usual. And I don't even know like who they're getting to vote for this because I didn't get to vote. But they say that they're getting plastic surgeons to vote who are the top plastic surgeons in the country for various procedures. Which
is the way to do it because I think, yes, having patients vote is great. And I think you're going to get a pretty accurate record if you ask the patients to do it. But sometimes, a lot of marketing goes into what is considered a top plastic surgeon. And it may not necessarily be based on actual skill or ability. But if you ask other plastic surgeons to vote, well, that means something because we do know what we're looking at when we look at, who takes care of patients well, who has good results, who's an ethical surgeon. Like that's what goes into when we vote.
Right. Because like a lot of times you can go to the reviews, which I think are pretty useless. Like I have a recent review from a patient who came into our office, committed crimes, I mean, literally, and was thrown out of the practice, who looks great, who's writing bad reviews.
Right. I will reference you to our review podcast on our true feelings on that.
Like, what? I think though the patients have become more savvy about reading reviews and be like, oh, this is a person who has issues, which is fine. Because people do have issues, they do. Course. And not all patients who start out as really great patients in their, whatever age, like they get older and things change in their lives. And so the reviews are really tough to go by. However, when you ask plastic surgeons who to go, like I had a patient ask me today, who do I go to for breast reconstruction? I'm choosing between this one, and Dr. Ravello. Now, of course, the other ones were fine, which I said they're all fine. But I can attest to the fact that I have seen Dr. Ravello's work, and it's awesome. And that is a very comforting thing because she'd chosen me for a different procedure. So then there it is. It's like, well, if you're saying that she's got great skill, I'm going there. So plastic surgeons are the place to find good plastic surgeons.
And because we go to the meetings, we see who gives the presentations, who gives the talks, we see their befores and afters, we know what they're doing. So yeah, I think having a peer-reviewed list like this is really a good way of them, to do it. I think that's smart.
Absolutely. And the longer you've been around and the longer that people have seen your work and that you've been in the same place, that can kind of be an indicator to you as to who's really delivering those results. So I was very happy to be on the Newsweek's list for rhinoplasty and facelifts and their new category, blepharoplasty.
And blepharoplasty, hey!
Which I talk about a lot, because it's part of my mid-facelift combo upper rejuvenation, and I do a ton of it. But I do a lot of, like I said, I've been doing lots of facelifts this summer. They're coming in a big wave, I guess, which is great.
Well, because you're a top facelift surgeon.
Evidently. and I like my results. You can see them on Instagram. You can see them on the websites. But it's really, do other plastic surgeons find those results to be acceptable? And evidently they do.
And they do. So, those were all really big honors. So big congratulations to you. 2 years in a row here. Odd that they didn't tell you.
I was a little bummed I wasn't on the breast augmentation list because I think I do some nice breasts.
You do nice breasts.
Thank you.
Well, something to strive for.
I know.
One has to have goals.
I gotta pump that out there somehow. I don't know. I mean, I do some really complicated redos and some simple ones too, but you know what it is
you don't do talks about it. You don't do presentations. So a lot of these plastic surgeons are surgeons that go to the meetings and hear you talk. And so if you want to get on that list, you got to talk about breasts.
I don't have time. You can't be an expert in everything.
That is true.
I mean, you really can't be. I mean, I guess you sort of can be, but I mean, I think I'm an expert in, and as you are clearly an expert in breast reconstruction, breast reductions, breast augmentation. You're all things breast. However, you're also an expert in facelifts. You just haven't been around for 25 years like I have.
I mean, I would say on average, most plastic surgeons are good at everything, but most of us have something that we really enjoy doing.
Yeah, my action is all here.
Yeah.
Face, nose, eyelids.
And clearly it shows. So
well, thank you.
Congratulations.
I appreciate it, and I'm glad we got to talk about it for a second. I'm glad that it's out there. I'm sure I will get ambushed next year if, God willing, I'm still on that list. It would be awesome. I did move up on the rhinoplasty numbers though. It's number 6 this year. I'd like to be number 1, but I don't know how you
number
get
5 next year.
All right, we'll shoot for 5.
Yeah.
Well, anyway, thank you, Dr. Ravello, for going over that for us and for the listeners. And this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.